healthcare and justice sectors within the nation really have faced a very hard time. Over the last 2 years, we've seen such a breakthrough with reducing the stigma that's associated with the justice system, but also that's associated with specialty healthcare areas like behavioral health or mental health. On the design side, Dewberry is really investing in looking forward 50 years. What does that emerging professional work group need and want, and how are we going to recruit and retain them? But also, how are we taking care of the staff that are at these facilities currently? What are we doing to differentiate our clients' projects so that these are the places to work and so that people can perform at their best with wellness amenities like fitness rooms, decompression rooms, robust training spaces, all the things that would help them operate on a daily basis and function at their best? How are we providing those, and how are we really making that optimum, not only for now, but for the future need? And so when we think about that, that's that continuum of care where somebody travels in and out, potentially of the healthcare system, in and out of the justice system. And really that cultural shift has changed. And so when we think about the last 5 to 10 years, the question previously, or what the question felt like it was, man, what's wrong with you? And how do we address somebody when we're already blaming them as a victim for where they're at? The question and the cultural shift now is, what's happened to you? What's your lived experience? What are the things, the traumatic things that have brought you to this place in your life? And how can we help? And how can we provide those resources and those support and the diagnosis and the treatment and the coping skills and the living skills and the relationship skills that are really going to help you break out of the continual cycle that you're in and move to becoming a really productive member of your community. As architects and designers within the system through healthcare and justice, our piece in part is really filling in the gaps of that continuum of care. It's studying communities, it's studying states, it's saying these are the needs, and this is looking at the holistic picture. These are the type of facilities that are going to support filling the gap. So for justice, it's not just correctional centers and detention centers and courts. It's specialty courts. It's specialty courts for mental health cases. On the secure housing side, there's this marriage between healthcare and justice where there are these crisis centers. So let's divert people from the justice system to a place that's going to appropriately treat them. And that's creating that wellness. It's how can we stabilize the populations within the community before they have to go through the criminal justice system. We will not see recidivism continue to reduce until we are bringing wellness at every single level. And that's what Dewberry does with our justice projects. We look to incorporate training, treatment, access to full health care, robust programs, the design of the environment, how it feels, how people can open up. And you can only do that through these programs so that people are trained in new ways to deal with anger, to deal with substance use, to deal with whatever their lived experiences that brought them there, so that they can actually go back to the community and get housing and find that job and be that productive citizen.